Hi, Dr. Rubinstein here. Just want to share with you my approach to fillers, specifically liquid facelifts. So what is a liquid facelift? Liquid facelift involves replacing lost volume in the bone, in the cheek, jawline, and chin, as well as the deep fat. When we lose this volume in our 40s and 50s, we start to get sagging of the face. So by restoring, it can have that volume can have a lifting effect. What's unique in our approach here is that we use the same concepts that I use in my deep plane facelifts. So with aging, not only do we get loss of volume in these areas, but we also get loosening of these ligaments that are all along the side of the face, from the temples, the outer cheek, and the jawline, even over here. So what's unique in our approach is that we are placing filler in this outer part over here, and very little in this portion. So the outer part where the ligaments live does not move much. The central part tends to move. And what I find where a lot of people place filler is in the part that moves, and it just causes this to be heavier. And when we smile, it looks unnatural. So we're strategically placing filler along these line of ligaments that has a lifting effect. Just like I'm doing in my deep plane facelifts, I'm releasing those ligaments, which allows the entire cheek and jawline to be lifted. So it avoids having the stigma of this overfilled face, which can look unnatural. We need a lot less product, and it's much more effective, because the goal really is lifting. It's not filling. We want to lift. And when we lift, we're taking these cheek fat pads that have sagged and putting them back higher up where they used to live. So again, we're using deep plane facelift concepts with a line of ligaments to get more natural liquid facelifts. Another question we get is, well, what kind of downtime should I expect with a liquid facelift, and how long will it last? So there's really minimal downtime. We prepare our patients. We have them avoid certain foods, medications that can thin out the blood a week before. We give arnica after treatment, and we even have laser treatments for bruising. So patients get back to work very, very quickly. So there's really no downtime per se, and minimal discomfort afterwards. The duration of effect is 1 year to 2 years with hyaluronic acid fillers, which are gel fillers. With biostimulants, which we also use, such as Sculptra, the results can last 2 years plus. So the difference is, with the fillers, the results are instant. With the biostimulants, it takes about 3 to 6 months to see the final results. But with the biostimulants, you also get some tightening of the skin. So we really guide our patients as to which approach is best for them. Another common question that I will get from patients is, well, if I'm planning to have a facelift in the near future, should I just not have any fillers? What's the point? So I think if someone's having a facelift in the next few months, yes, then I don't see the point in having a whole liquid facelift. But oftentimes I have patients that will say, well, I'm not sure, maybe in 1 year, 2 years, 3 years, I'm planning on having a facelift. So I don't see any reason why they can't have a liquid facelift, especially the way that we do it, where we're using less product, and also I'm injecting the product mainly in the outer part of the face. And that's not where the deep plane facelift is performed. The deep plane facelift is done in this part over here, and there's almost no product placed in this area. Another common question that we get has to do with biostimulants such as Sculptra and Radius. Can I have a Sculptra treatment in close proximity to a facelift? So for example, if you're planning on having a facelift in 3 months, is it okay to have Sculptra? And that's a question really for our patients. But we've also had patients who have come elsewhere for their facelift consultation and already had their Sculptra in the near past. So is it okay to have it? So I know that there have been a lot of posts about this topic, and there have been discussions that the Sculptra can potentially create scar tissue and cause the various layers in the deep plane to get stuck together. An analogy that I think is very good that's been given is the pages of a book that are glued together, so you can't really lift them. So I think I have 2 answers. For my patients, because of the way I inject the Sculptra, I do not have an issue performing a facelift on someone that had a Sculptra a few months prior. For patients who haven't had Sculptra in a while and are due for their maintenance, then I will hold off on their maintenance treatment until after the facelift if it's still needed. So the reason that it's different for my patients is really how it's injected and where it's placed. So most of the sculpture is placed along these line of ligaments. It's placed on bone and deep fat on the outside in this area over here and right along these ligaments in this area. The deep plane facelift is performed right here. So it's really not in the area where the sculpture is placed. So you should not have an issue with it getting stuck down. The other reason that I have very little issue with the sculpture is I don't form in most of my patients these nodules or papules that can stick the structures down because of the technique. So I'm placing tiny droplets. I'm not injecting these big boluses of product. And when you inject large quantities of product, that's how you can get these nodules or papules that can create a problem. So the reason I don't see it is where I place it and also how I inject the sculpture. But patients who have had sculpture elsewhere, I have to assume that it may not have been injected properly and it may have been placed in the areas where the deep plane will be performed. And for those patients, I will have them wait up to a year to have the facelift. So in summary, liquid facelifts are incredibly natural when performed properly. And using deep plane facelift concepts, they can last 1 to 2 years and even longer. And our patients are just thrilled with their results. Thank you for watching. If you have any questions, leave them in the comments below.